Many people think about it, but saying it out loud, well, there is no opportunity because they are embarrassed, because after all, it is an intimate area. Using a cannon to shoot sparrows, you don't need to do this right away because ultrasound diagnosis is very simple. It does not require anesthesia. It does not require hospitalization. It sometimes takes 5 minutes, sometimes half an hour. Halana Janovic, not more. This method works. I have redone almost 5,000 or more of these procedures. Many women become pregnant within 3 to 5 months.
You said that the contrast, not exactly the contrast, the fluid doesn't pass. You don't see it. She can then really go for a laparoscopy to confirm or refute this, or understand if there might be a need for reconstruction, restoring the patency of the fallopian tubes, or some other issues. Have you had such cases as well?
You can do everything the next day. Therefore, we definitely need sanitation and to know that everything is fine. When I see that a woman hasn't been sanitized, I say, okay, treat yourself, then come back. Because the most important commandment of a doctor is do no harm with medicine.
Moderator,
right?
yes, do no
right?
harm. That is the most important, yes. Hello to all our dear viewers. Today we have such a cool podcast because here in Chernivtsi we have a studio called Yuzko that gives us the opportunity to film these podcasts, a superstar. In general, it's becoming a tradition. Whoever comes to Chernivtsi, I invite everyone to the podcast because I believe it's a unique chance for you to talk about yourself, about your opportunities, about what you are doing. To everyone on our channel. So today we have with us obstetrician-gynecologist, an expert in ultrasound diagnostics, Olena Susidko. Olena Susidko has come from the city of Dnipro. Please tell a little about yourself to our viewers and we'll start discussing a cool topic.
Thank you, Viktoriia, for the invitation. Because you are almost, well, perhaps one of the few who discusses women's topics at such a professional level, women's health. And this is a very important topic because many people think about it, but don't have the opportunity to speak up because they are embarrassed, as it is still an intimate area. And I also started doing this just like you because my parents are doctors too. And the Dr. Nikolaev Clinic is named after my father. Like you and Yuzko, your father started, and mother, and we with you, we can say, are already in the second generation. Dynasty, yes, of doctors. And so I think it's already in our blood, yes. To treat, to help the women of Ukraine. I am a doctor, an obstetrician-gynecologist, a pediatrician. I work in pediatric adolescent gynecology, also a geneticist doctor. And my priority areas are prenatal ultrasound diagnostics, pediatric gynecology, and also aspects related to women's reproduction. Tetiana Lyashenko, in Dnipro, we have 4 clinics. We've been operating since 2012. It all started with one office and then it grew into 4 branches. One of our branches is in the city of Pavlohrad. And now it's very relevant because in the difficult times of war, many women travel sometimes for several hours to get to us specifically for professional help and support. I would like to talk today specifically about reproductive medicine because it is the future of our Ukrainian nation and it is one of the most important things we do.
Yes, yes. And what appeals to me about you, that I look at your Instagram and think, oh, let's meet, let's do something cool, tell, teach, some new opportunities above there is. And I know I have turned to you exactly to the right address because I know all the novelties, everything that is cool, modern, new in reproductive medicine and also in ultrasound diagnostics is with you. And so today we would like to choose a topic such as the possibility of getting pregnant and knowing that the fallopian tubes are open. Here's about this topic in ultrasound diagnostics. I want to ask you in detail. Why? Because let's say some will say they believe in it, some don't. Some say to perform surgery, some say to do only an X-ray. But I know
We know that you do this using ultrasound. Tell us, what is it exactly? Can the fallopian tubes be examined using the ultrasound method? Yes, I've been working on these topics for a long time, since 2013. And tomorrow we will have a conference and a master. There are many debatable topics here because, of course, the doctors who specialize in these areas often have differing opinions based on their experience, interpretation of research, and clinical practice. Those who do it, the surgeons, reproductive specialists, of course, say, what kind of quackery is this and why do it? You should immediately perform laparoscopy to find out if the tubes are open or not. But, it's like using a cannon to shoot sparrows. You shouldn't do this right away because diagnosis using ultrasound, it is very simple. It does not require anesthesia. It does not require hospitalization. Sometimes it takes 5 minutes. Sometimes it takes half an hour. No more. And on a pain scale of 1 to 10, you could say it's about 4 to 5. Therefore, it has its place and it will be the first method of diagnosis when a couple comes and says they cannot have children for over a year. As we know, infertility is more than a year. The first thing to do is to check the patency of the fallopian tubes in women. And why? Because if they don't know, we are now talking specifically for regular women, not for doctors, that the sperm meets the egg precisely in the fallopian tube. Therefore, in this hallway, if we do not know whether they will meet or not, this is the most important thing to start diagnosing infertility in a married couple. So this method works. I have redone almost 5,000 or more of these manipulations. There were different cases when I was really scared, maybe something would happen there, like a rupture of the fallopian tube or some complication. But tomorrow I will tell the doctors at a medical level. Halina Yonets, in medical terms, what can be the difficulties during this procedure.
and what we use and how we conduct it. Tomorrow I will be telling the doctors exactly. You began with mentioning that surgeons are very categorical. That is true. Before we invited you, I also told the surgeons. I said, oh, this is such a cool new method. It's so simple for the patient. The patient comes in half an hour, she knows the answer. She needs an operation, she needs to go for IVF. She may just need ovulation stimulation. The tubes are patent. I say let's all gather. They will show us everything in detail, all the details. And the surgeons, I don't know why we need this. Laparoscopy will show everything. And this method, well. So tell us from your own experience. How much did this method actually help your women to get pregnant? Choose the right strategy and not waste time.
Look, just like you, I approach medicine from the perspective of evidence-based medicine. And we want our women who read a lot and know a lot to also want evidence-based medicine. Certainly, yes. In this case, if we are talking about the patency of the fallopian tubes, corpse, yes, it could be quackery, and they might say that what she saw there, we don't know. If it's an X-ray, we'll have film, right? But if we are recording, we definitely record all of this on video, and we have evidence, it's a video. And I have had cases where I said that the fluid does not pass through the fallopian tubes. It is also very important to note that we do not say the tubes are passable or impassable. We do not say it like that. We say The liquid passes or does not pass. Why doesn't it pass? Maybe there's some sort of adhesion, right? Lying like a log on. Well, if speaking for ordinary women, lying on our tube, or the tube is somehow twisted or something else, we don't know. But we see that the liquid does not pass through the tubes into the cavity, the abdominal cavity. That's why it's very important to record video. I had a woman to whom I said that the liquid wasn't passing. She went for laparoscopy, and there they told her everything is passable here. No, then she turned to me and said, what did you tell me? Oh, I said, I have a video. Here you go. If you want, you can take it anywhere, even to court if you want. But I have evidence. And I asked her, did they make a video of your laparoscopy to also have a basis of evidence? She said, no, they only told me verbally and wrote a conclusion. Therefore, if we want our diagnostics to be genuine, effective, and to tell our patients that our medicine is evidence-based, we must make Chine loops to show what we actually saw, not just write it down. That's first. Secondly, after this procedure, this manipulation, I'm not saying it's an operation, it's a manipulation. After this manipulation, many women became pregnant within 3 to 5 months. Why? Because I used not simply an echoist who was proposed with some contrast, but there I have a whole lot of, it's, well, as I say, a magic mixture. I will also explain tomorrow what exactly is included in this mixture. But for ordinary women, I will say that we make this procedure not only diagnostic, but also therapeutic, no? One and also. And this procedure helps not only to look at the patency of the fallopian tubes, but also to examine the uterine cavity. Very often they look at the ultrasound and don't see any hidden tumor process. Hyperplastic processes in the endometrium or polyps, they can be isochoic and they are not visible with regular ultrasound. When we enter the uterine cavity, add fluid there, and expand the uterine cavity, we see the entire endometrium. I will also show and talk about this tomorrow. Therefore, we have a therapeutic diagnostic tube we see, and diagnostic ultrasound scanning. Ultrasound scanning allows us to see inside the uterus. Ultrasound scanning allows us to see in the conified layer. Ultrasound scanning allows us to see inside the abdominal cavity. Ultrasound scanning allows us to see inside the abdominal cavity. Ultrasound scanning allows us to see inside the abdominal cavity.
Understood. If the patient, for example, you said that contrast, not that contrast, the liquid does not pass, you do not see, she may then indeed go for laparoscopy to confirm or refute this, or to understand if reconstruction is needed, a restoration of uterine patency, the tube, or some other aspects. Have you had such cases as well?
It is essential when we see that the fluid is not passing on both the right and the left fallopian tubes. We write in the recommendations. We do not write tubes are blocked. We write fluid does not pass through the tubes. And we write that diagnostic, therapeutic laparoscopy and hysteroscopy are recommended. These two methods will be able to make it then already the gold standard. Of course, we have laparoscopy, but shooting sparrows with a cannon right away is unnecessary.
Understood. I understand, because probably everyone talks most about what they know. If it's a surgeon, they will say laparoscopy. You talk more about this method because you have experience. You said you conducted how many examinations?
5,000. More than 5,000, yes.
Isn't
How
that
do you
right?
find this procedure itself? Is it easy, straightforward to conduct? How does the woman behave during this procedure? Maybe
It depends. I would say it's like painful periods, painful periods. If a woman
Glitching, yes.
has very painful periods, that threshold, well, almost like painful periods. There are specifics, I will talk about them tomorrow. If, for example, a woman has a small uterus, there are such small ones, but it is normal, they are more sensitive. Here, it happens that after the procedure, a woman feels no pain, but 15 minutes pass and spasms and the gag reflex begin. Why? Because it's a delayed reaction to the opening of the cervix, specifically the internal os. That's why we ask the woman to stay at the clinic for half an hour. And if that happens, she's under the supervision of nurses. And after half an hour, she can already resume her activities. And it is very important that one of the advantages of these procedures is that the next day, a woman can engage in, and she can become pregnant in the same cycle. Is it necessary to skip? No, it's not necessary. Everything can be done already on the next, but well, still the next day we see sometimes removing blood is uncomfortable. Well, in 2 days for sure we can. Therefore, if we did it, for example, on the 6th, 7th day of the menstrual cycle, then during the ovulation period, we can do insemination if needed. And she can lead a sexual life. We don't skip this whole cycle, which is very important sometimes for women who now during the war, many of whom come for just a month, and they want everything right now. They want to do it within a month. Yes, yes. And for these women, it is optimal and exactly what is needed. Understood. Understood. They probably already know that you do this and specifically come to you for it.
Not matter?
Well, yes, in the Dnipro, they come to me and
I have been doing this for a long time and professionally, so they come from various clinics with recommendations from other doctors. Understood. Then they probably return to their doctor with this recommendation, and the doctor decides on the strategy of what to do next. Yes.
Is that so? Yes, of course, yes.
Understood. And how do you compare, for example, the ultrasound method for checking the patency of the fallopian tubes versus X-ray? What can you say about these two methods and any pros and cons from your perspective?
Yes, we will talk about all this tomorrow. I will compare both the X-ray and both ultrasound and laparoscopy and fertiloscopy. If yes, I know what you are doing there too. And there are many pros, many cons. But today I think we won't manage to go through all of these. Yes, in general, yes. In general, I will say that randomized studies were conducted which showed that both methods have 80% specificity. The ages are, one is 81, the second is 80, and 81 is specifically for ultrasound. Therefore, just if we compare, for example, the drawbacks of X-rays, there are many. Firstly, not every clinic has an X-ray machine. In Chernivtsi, in the Chernivtsi region, I will say, we do not currently have an X-ray to check the patency of the fallopian tube using X-rays here.
There's
or
none
if,
in the region.
for example, we have it, how is it done in Dnipro? In one office, she's inserted with this catheter, then she's laid on a gurney, or she goes with it to the X-ray room, and it is done there.
Metal?
No, not jelly, not
really?
iron. Yes, this one. And it's very inconvenient. And still, there's a static image, there's a picture, and that's it. A picture, and you interpret it as you want. We have dynamics, we see how all this goes, and we can watch everything in dynamics. So if you compare, X-ray is the past. Ultrasound is, I wouldn't say it's the future, it's the present. The present, which we routinely do for every woman when addressing infertility.
Understood. And now there are also specially registered substances abroad to check the permeability of peace pipes. Almost all companies advertise these substances, saying they provide such contrast. I know that in Ukraine they are not registered now, this particular substance. Have you encountered their use in your practice? Is it possible to apply them, and how good is it?
I was on an internship several times in Israel and in I was in Hadassah and I was in Tel Aviv in a big clinic, and I saw exactly how this is done. First, they
use catheters that are thinner, not the ones I use, thinner ones needed for IVF. Yes, but that is one
This is thawing the
catheter,
cows?
very expensive costs.
Yes, stop.
Very expensive. And then this procedure will be very, very well expensive. That's why we use other catheters. Tomorrow, we will show those for metrosalpingography, which are produced right here in Ukraine. And that's why this procedure might not be as,
not as expensive as abroad. And yes, they use these
liquids, the liquid that is needed specifically for patency, but we use such medications that about each medication, about its action, about its benefits, I can tell. Well, for example, we use ceftriaxone, right, when we administer it. But first, we check to make sure there's no allergy. We do tests first. Here, ceftriaxone. If, for example, a woman comes to me, she's not mine, not examined as I would know, she comes from another hospital, then it's a preventive, let's say, premedication. Let's say we see that even if we will have a medicamentos hydrosalpinx after the procedure, we will know that we have ceftriaxone there, which will not allow pelvic peritonitis to develop. I want that.
For our viewers, you explained what hydrosalpinx and pelvic peritonitis are. Yes, in simple terms, because women are watching us so that they understand.
Yes, when the tubes are provoked, for example, if there were untreated chlamydia, this is the most ureaplasmas, chlamydia. If they were inadequately treated and we go in there with some substance, there may be adhesions. They expand and fill with this fluid, and this can cause a flare-up, kind of a recurrence of this infection. I've had one such case in my entire practice, after which I vowed I will only use ceftriaxone. This woman was allergic to ceftriaxone.
And you
didn't do this injection.
Right?
And well, if there is an allergy, for example, then we can apply, we can use some broad spectrum antibiotics beforehand.
Other
Yes.
groups?
So, and she had an undertreated chlamydia, and we found that these tubes expanded. But this is often medication-induced hydrocephalus, and they usually resolve on their own. However, this woman developed a fever. She was hospitalized and she lost 2 tubes. She had surgery. Pelvic peritonitis is inflammation. It's like peritonitis. Many people know what it is, peritonitis, right? Well, and this, but she was treated for a very long time and they couldn't find the cause. And only after 5 years of treatment, she achieved this patency. We found out and removed the tubes and did IVF, and she came to me pregnant, and she came to you pregnant, right? Yes. And she said, at first she was like, what did you do for me? And you understand, when colleagues might say, oh, they made the passage for you, maybe they did something wrong. But the colleagues were very, correctly oriented. They explained that this could be, so we definitely write you. In complications, it could be 0.1%, a percentage specifically of this pelvic anterior. Therefore, it's essential to thoroughly examine, check the woman's flora smears, and review for syphilis, HIV, and hepatitis to ensure everything is fine, because this is like a small operation. Although it's a manipulation, it's an invasive method. So it is crucial to pay attention to this.
Logi, I know what they do to women,
Well,
that it's
something,
loud, that they shout.
either the cytology or
to
the
avoid a blockage in the
yes,
process, right?
we enter the uterine cavity. We don't want to introduce any flora from the vagina there.
So for our viewers, explain why we can introduce some flora from the vagina, for example, and it can end up in the fallopian tubes. Just like that, explain for the viewers how this is possible, why it is important to perform sanitation and to know that a flora smear is okay.
Well, simply put, we have the vagina. That's it. Everyone understands. Next, we have the cervix with an external OS and an internal OS. These are the gates that hold our uterine cavity and all the fallopian tubes to prevent infection from entering, infection of any kind. And there we have everything, a lot of mucus, and it doesn't let anything through. But if we have an infection here, we insert the catheter, pass through the external and internal openings, and enter the uterine cavity. We can introduce this infection from the vagina and cervical canal right here. That's why we absolutely need sanitation and to know that everything is fine there. When I see that a woman has not been sanitized, I say, let's have you get treated and then you can come back. Because the most important thing is not to violate the doctor's oath.
Maria Anatolievna, hardly anything there. Medical knowledge zero and in vain. Svetlana Ulyanivna, that's exactly it. So it's clear.
And therefore, everyone must understand that they also need to prepare for this procedure. And I am very grateful that you mentioned this triaxon, that you have experienced, that you use it. Because sometimes when we were preparing, we would tell women there is special preparation needed, everything. And they would ask, why do we need this antibiotic? Why do we need this? So you've explained in detail what it is. Tell us what else is important there that helps us. Dexamethasone. Why do I think that many women then get pregnant within 3 months after that? Also, as far as I know, many studies are being conducted.
And if, well, from my experience, I see that there are such NK cells which, are also in the endometrium.
Yes.
And they are not yet fully researched. It is considered that when a fertilized egg arrives there, the embryo, those NK cells actually interfere with the implantation of this fertilized egg.
Yes.
So what does dexamethasone do? Dexamethasone suppresses these these NK cells. That's what I think, because I understand that if a woman becomes pregnant after this procedure, then maybe that's the reason. But research is needed, a lot of research.
But this needs to be studied very thoroughly. So dexamethasone, there's also heparin.
In each tube, just like that, there's a tube from the uterus. And there are such villi, such fimbriae, that work along the ovary and capture our egg cell. In this fimbriae, when they stick together with some kind of this derivative, doesn't allow this fimbria to work like this. That's why heparin, it specifically works by dissolving this derivative, and the fimbria become more mobile.
Elastic,
yes.
So to better...
And they more quickly take the egg cell into the fallopian tube.
Yes, it's true, because they say fimbria are fringes. Yes, and that's why it's important too. Why so? Because when we do an X-ray, we don't have this information at all. There we just have yes, everything is so or not. But sometimes I even tell patients, for example, 100% verification method is taken on faith. That is, we know for sure that they are passable, because, and yet we don't know, because fluid might pass. Everything can be done, but functionality, they still might not function, even though the fluid passed. Yes? How much time do you give the patient if you have checked and said everything is fine, the fluid passed into the abdominal cavity? How much time do you give her to get pregnant on her own?
Wind up to 5 places.
And what if 5 months have passed and the patient hasn't gotten pregnant?
Gets pregnant.
Did not get
Didn't
pregnant?
get pregnant. Well, reproductive specialists, and yes, unfortunately,
according to the strategy further.
every
So, yeah.
gynecologist here considers themselves a reproductive
Overcame.
specialist.
I wish for something completely
This is
different.
completely different, but everyone tries to help in reproductive medicine. But you need to go to a reproductive specialist. And you are one of the most powerful clinics, not only in Chernivtsi, but also in Ukraine. Therefore, I
That's good.
believe that if such a procedure is done, one must definitely wait 3 months, no more, and then definitely see a reproductive specialist.
I understand. I agree with you that this is very correct because sometimes people waste time. Sometimes they believe in something and think they can wait a bit longer, but no one knows what the ovarian reserve is. How long can we wait for everything? Therefore, I agree with you 100% that it's necessary to give the patient a yes or no within a certain period of time. And tell me, please, for example, do you perform checks? The passage, then stimulation and something else. Do you have such patients?
Yes, of course, we do everything except in vitro fertilization.
Okay.
We do inseminations. We do all stimulations with medications. Everything is the same. But in vitro fertilization, when we see, I think that if a doctor works with a woman for half a year, well, let it be 9 months. And engaging with the woman, yes, you know, the woman follows the doctor's advice, does everything, and nothing works out. Don't wait. IVF, no need, especially when 35 plus, 6 months, and IVF. No need further. We don't have time.
No time, yes. Everything is, of course, very individual because we can't force anyone. Everyone has to go on their own. But you know, now there are state programs that provide the women the opportunity to complete the program for free.
Everything that's free cheese is only in a mousetrap.
Yes, maybe.
That's what I
but
say.
Now the position has changed a bit. And now, for example, I can speak for myself personally. For our clinic, I don't know about others. But for us, it operates. It truly is a comprehensive free program. The state, the National Health Service, covers a large amount, which includes everything: medications, puncture, egg retrieval, anesthesia, embryological support, ECSI, embryo transfer, and even cryopreservation of embryos. And we are proud of this program. It hasn't been operating for even a year yet, but it really is.
And the results?
And the results are the same as in the paid program because everything used is the same. For example, before, but now how? A patient comes to us and says, I want to join the state program. We conduct it. And the state provides funds, the amount for what we have done. So whether we conduct this on a commercial basis or on a state basis, it does not matter to us because it's either the patient's money or the state's money, and both are the same. Therefore, the doctor, equipment, embryology, medications are all the same.
Olga Reikova, you know, now the questions will probably start pouring in. How much does this program cost?
For the person,
well, no,
it's free.
I understand, but how many citizens?
Almost 93,000 for a full DRTNC cycle. Wow.
Well, this is bravo for our state. If you, and I know your father, he is the president of the Association of Reproductive Medicine in Ukraine, and I think that he has made a very significant contribution to make this free for our Ukrainian women.
You know, many women come and also say that we don't believe that this is truly free. How is that possible? Not paying anything in a private center? And I say, yes, indeed it is. And now we already have many pregnancies, good results. And we ask them to write that this really, Dr. Anna Stanko, indeed it is so. Patients
I will
come
know.
from
I did not know. There you go, catching on with my ears.
Yes. So I deliver for free. They record the consultation and everything. That is, we just approach the patient. And for us, it is such great happiness that the patient pays nothing, because we always worked in private medicine and didn't even know that this existed, but now it exists.
But there is a choice, a clear choice.
of whom you take for the programs?
The only criterion is age. Katerina Olsheva, this is the only criterion up to 41 years.
Any
And
woman
indeed,
can
the
do this.
factor. Yes, any woman. Well, the only thing is the factor of infertility. And tubal infertility is included as an indication as well, one of the indications. Therefore, for me as a reproductive specialist, it is important to apply your method and to have a conclusion, for example, that the uterine tubes, Svitlana, passable or not passable, or the contrast didn't show in the uterine cavity, and then I understand it because the patient has to come to me as a reproductive specialist with a diagnosis. Tetiana, yes, and what I said is very important. The video clip needs to be Svitlana.
Doctor.
Effect.
So that you, if you trust this doctor, you need a mandatory evidence base that yes, of course, he can do this. Therefore, and if there will be, like tomorrow, we have almost 30 people. Yes, there will be. They all want to learn this. And it's very cool. If all gynecologists, colleagues who do not do IVF, will specifically perform these tubal patencies. She saw, it's blocked, 3 months, that's it, to Yuzko for the program, understand? And it's very well. Well, I think it's a plus for all doctors, not just for reproductive specialists.
Psychologists, yes. And also with these free programs, 15 centers in Ukraine signed this program and they are really doing it and there are real results. Personally, for me, my female patients who completed the program completely free of charge.
Blogger. And how many do you do in a year? How many such women do you take?
As much as I want.
Gerda, and how much will the state pay you, sir?
I am covering the costs for everyone who wishes. At the moment, there is no problem with this.
Modestia Bilan, probably not many people know about this program.
She only started actively in March. That was just the beginning. And then around June, we began to work actively.
Medical center will sign such a contract with you?
With the National Health Service of Ukraine will help you, tell you. And in general, we probably encourage everyone to do this because I can't share the joy, how great it is when a patient comes to you, for example. She did a walkthrough with you, you say that unfortunately the fallopian tubes are not functioning and you indeed have the right diagnosis of tubal infertility. Well, considering all these factors, everything, she can indeed receive in vitro fertilization or IVF for free.
Anastasia Pristayova, that's right. But still, if a council is convened and if there will be surgeons based only on ultrasound, still might not believe, and they can offer the woman the gold standard. It is laparoscopy to ensure that the tubes are indeed blocked, then confirm this and then take it into the program. I think
it
still
can be done
do it.
like this. Well, yes, but it all depends probably on the composition of the council, on who evaluates it, on the quality of the work conducted, the ultrasound machine, on its quality, because I understand where everything is clearly visible, everything is described, that is sufficient. But if it is unclear there, incomprehensible, or the specialist lacks experience conducting it, then yes,
you need to write everything clearly without buts or ifs. It's not necessary.
Really?
You should I treat patients as I would like to be treated. That's why everything is transparent. And my medicine is based on evidence-based medicine. Everything I do in my work.
You see how it is becoming easier in the modern world. You can do it, get a checkup quickly, join a program, everything. And today, when looking at patients, as I see the patient's situation, they really want everything to be quick and quality. And it doesn't traumatize them morally, these cycles of going through everything, all of it. Therefore, in my opinion, this is a very cool method, and that's why we gathered. Tomorrow, we will have such a workshop so that you can show us this in detail.
They said, yes, because patients, as I mentioned today at another conference, should be viewed through the lens of generations. Generation Y and Generation Z, these are our reproductive age patients who want to get pregnant. Zs, as they're called, Generation Z is 14 to 28 years, they want everything quickly now and fast. Y generation 2, they want an evidence base, but they also want immediate feedback. Therefore, approaching this generation from our perspective as doctors, we need to provide it to them quickly and efficiently.
Well, and let's say not very expensive diagnostics and therapy, so that a person knows what to do next. Yes, and make their own decisions. I am very grateful to you and all the doctors who are so modern, so innovative, whom you can talk to, who can share this knowledge with everyone. I urge patients, if you want to consult a specialist to check the patency of the fallopian tubes using ultrasound with such experience, then go to Olena Susidko, because not everyone in Ukraine can boast of this. To boast. Many do this. Well, to have such experience, because it's the eye, you also have to look. Not everyone can. They are afraid to talk about it because they don't always do it well. I'm not afraid tomorrow will show, give
Girl, God willing, it'll all work out because, you know, it's such an unpredictable thing.
Yes, yes. So we will be looking tomorrow. Thank you very much for coming here to Uko Studio for for telling us this, for telling our Bukovina. And YouTube is such a platform that gives the opportunity to tell all women that it is comfortable, normal, simple, and fast.
Yes, thank you. Thank you, Viktoriia. See you tomorrow.
Thank you. See you. Happy
Doses.
night.